Hello. Welcome to the American Heart Association meeting in Chicago. This is On the Scene for the ACC. I'm Kim Eagle from the University of Michigan, and today I'm joined by Salim Virani, who is from Baylor. And we're talking about what I think is the most important trial that was presented at this meeting, REDUCE-IT. It's a study looking at the value of a fish oil substance in reducing risk in certain groups of patients. Tell us about this trial, Salim.
Yeah, so this was a trial that had two kinds of patients that were enrolled, those with clinical ASCVD or diabetic patients with additional risk factor. Uh, the thing that's interesting about this trial is that they targeted the right population for omega-3 fatty acids,
High
those
risk.
with high triglycerides,
Right.
exactly, because in the past we haven't had patients who would have that much triglyceride elevation. So I believe the median triglycerides were 216 milligrams per deciliter. And then patients were randomized to either purified EPA 4 grams versus placebo, which was really an active placebo. Patients were on statin therapy. And then they were followed for 4.9 years, where it was associated with a fairly significant relative and absolute risk reduction for major cardiovascular events, risk of MI, cardiovascular death, which is very interesting. So very interesting trial.
So I think it's important to note this trial, unlike VITAL, which was also presented here, which sort of is a shotgun approach. We're going to give everybody a fish oil substance, and that trial was wholly negative. This trial established cardiovascular disease. 70% of them had it. The other third had diabetes, and they had high triglycerides. So they targeted specifically a very high-risk group. The other thing is that the fish oil was at high dose, wasn't it?
Yes, it was high dose and it was EPA, and that again begs the question that dose matters, because in the prior studies when we have used low dose, generally they haven't worked in more contemporary trials. In GC heart failure, GC prevention, I mean in early 90s it worked, but in the more later trials, low dose of fish oil has not worked. And then exactly as you said, patients with high triglycerides is another thing that's peculiar about this trial.
Also, I think of importance, first of all, 5 years of follow-up and hard endpoints. I mean, cardiovascular death was lowered, all-cause mortality was lowered. That secondary endpoint, I think, was MI, stroke, cardiovascular death. The number needed to treat was about 30.
Yes.
So this trial was surprisingly positive, I think. So I guess it begs the question, does this single trial, should it change our practice? Or do we need another trial, a confirmatory second trial, to say, yeah, I'm going to do this in all these patients?
Yeah, so we do have another study, Strength, that is recruiting similar kinds of patients using high dose of fish oil. So I personally think these results are amazing. I mean, and if they are replicated in another trial, then I think that then becomes two trials that you have with very similar kinds of populations, similar dose, although the formulation is a little bit different, then that really pushes the practice in that direction. So for now, these are great. We have another option available to treat high-risk patients,
Right.
but I would rather wait for another trial.
So the triglyceride level dropped quite a bit. I think it dropped about 30%,
Yes.
something like that. And tell us about the safety. Is it safe to use fish oil in these patients?
Yeah, good question. So overall, there were no major safety events, but as you know, there were two things that were noted. One was an increased risk of AFib and AFlutter, as well as a little bit increase in bleeding events. Obviously, the absolute risk was not as high as the absolute benefit, which you and I
Right.
talked about.
Yes.
The benefit was very high. So that has to be kept in mind, and maybe that antiplatelet effect of fish oil is another mechanism that's leading
Right.
to some improvement in primary outcome as well.
So it may have a slight bleeding risk, but certainly potentially a favorable risk on coronary thrombosis. So REDUCE-IT, I think, is the most important trial this meeting. And I tend to be with you. It's like a 2A recommendation for me right now. If I can't get the triglycerides down in these patients, I might consider using it. Listen, I want to thank you for speaking with us today, and thank you to our audience for On the Scene.